One of the things that I would say would be one of the most alarming trends that we're seeing is the, rapid rise in utilization for behavioral healthcare services. And when I say rapid, I do mean that, before the pandemic there was a demand. The pandemic has exacerbated it, exponentially. So, for example, on the commercial side of business, so all of us here in the room today, we've seen from 2020 to 2021 a 40% increase in utilization for mental health and substance use services. There is not that amount of people in the community to serve those patients. So we know that many of our patients are waiting, or were waiting, about 1 to 3 months to get that initial treatment. If you're in the middle of a crisis, if you have a mental health issue, you finally decided that it's time to see a therapist, and you pick up the phone and you're told that you have 1 to 3 months to wait, that's not okay.
Affected us is the flight to what we refer to as agency staffing. Maybe you've heard it, travelers. There was always a need for that in healthcare, and we used to think of it as a last resort. If staffing was low or we had people out on extended leave. This keeps me up at night. The amount of money that someone can make going to be an agency nurse, and before it used to be to travel, go to Alabama or Nebraska or Oklahoma. Now it means you sleep in your own bed and you drive to St. Peter's Hospital instead of driving to Saratoga Hospital for 4-5 times what we can pay. So that's something that really needs to be addressed, whether it's legislatively, whether it's, I don't know. We lose people every week to this phenomenon. And it's hard to deny that this is something that young folks with debt don't want to pursue to pay off their mortgage and pay off their car loans. But it is devastating healthcare. It's devastating healthcare. So that flight to agency is something we're all grappling with.
There's always things you need to do, always. But we've had to change a lot of things. There are increasing numbers of roadblocks that are preventing students from getting into college and then succeeding in college, not the least of which is the financial aspect of that. And just full disclosure, my daughter started off with a degree in laboratory science, decided to go back, direct entry nursing, went to a private college, it was on her dime that time, and is now, well over $100,000 in debt. So she's considering, guess what?
Hudson Headwaters.
No. I'll tell her that, but she's considering going to work for one of the travel agencies because she can make 4 or 5 times the amount of money and work for 13 weeks a year and make almost the salary that she makes at St. Peter's Hospital. So those are considerations that you have more than I do, but I do know those are roadblocks. The fact that a lot of the students in nursing, and actually all healthcare fields, not just nursing, and actually all fields, are women who have children at home. They are looking for opportunities, ways to get through their education while they are still caring for their kids at home, and that was particularly a problem with COVID because their kids were home with them the whole time. So, that was also part of the challenge.
The greatest thing that we saw during the pandemic, I don't think it was caused by the pandemic. We talked about a decade ago that there was going to be a staffing shortage. It was exacerbated by the pandemic because baby boomers were getting out and they were saying, I didn't sign up for this type of work. And years ago, a million years ago, when I was young, families were having 5, 10 kids, and now families are having 1, 2 kids. And so by nature, the population is shrinking, so the pool of people was always going to be a problem for us. What I didn't anticipate that has happened, and we've all experienced it, was the rapid increase in wages. So we have done so many increases, which is great for the staff. It's not sustainable to keep going, but in nursing, in patient services, and it just seems to keep happening. I just heard Target Warehouse is now paying $24 an hour, which is just under what I'm paying at LPN. So I think that's been the biggest challenge. Who's benefiting, obviously, is the these employees are getting good wages, and that's all great. But trying to figure out the sustainability and to feather on what you said, it's kind of ironic that we have nurses that live here. My daughter has 2 RN friends that graduated, and they're going down to this city as a traveling nurse, and then you have people from the city coming up here, and I'm like, we're swapping, and we're all paying this fee, so there's gotta be something. Local recently said, we need to help the healthcare field currently medical assistants in New York State don't have to have any licensing. Many of us probably put them through certification, but if we could just expand the role a little bit so they could do phlebotomy and they could do injections, that just helps the nursing problem. So I think that's some of the areas that we're working with our legislators and education. So I think we all do talk with the schools.
Yeah.
Not everybody who's working in healthcare is working as a clinician, right? And so at CDPHP, our IT and analytics team is, larger than our medical affairs team.
Sure.
And the problem is that now, so it used to be, Allie Skinner's not going to uproot her 14-year-old daughter who's in the middle of middle school, right? I'm not going to do that. So I would never leave the capital region. So I was always kind of in this bubble where this is, how much money I'm going to make. I could get a job on the West Coast now. I could get a job in Japan if I wanted to now. So that's the other thing that we're competing with in this, hybrid or virtual environment, is that you're not just competing in the capital region anymore, you're competing globally.
Correct.
And that is, you talk about the wages, that just makes the problem worse. Or
Yeah.
better, if you're on the, if you're on the shopping side, it's better.
Right.
But if you're, if you're on the other side of the equation, it's tough to.
That's a good point. Is it going to slow down at all? Dutch, when you look at Wesley, you see, like you say, we need staff. If you had more staff, you'd put more people in. Are there the people out there to put in the beds?
Yes.
Okay.
Yes, Saratoga Hospital is already impacted by Wesley having to kind of retool how we're operating. And, the baby boomers are aging. So for services like, I know
Don't say that
I'm
too
one of
loud.
those too. I think I'm on the younger side, I don't know.
I am.
But-
I'm like 2 years before,
Yeah.
they didn't call me that anymore.
But it's an aging population when you look at the demographics of people are getting old, and we have the baby boomers that are really getting to that aging, and we're looking to downsize. They're looking to move into facilities like ours, not the nursing home, but more on the the housing side. As they continue to age, they're going to need services like ours. Now, will we need to be a 342-bed nursing home in the future? I don't know. That's all going to depend on the workforce, I think. But I think the need is there. But I think people are also looking to stay home longer as well. So
Yeah.
that workforce, to be able to support people living at home longer, is just another concern, because everybody says it's home care, and home care is where it's going to be. Oh, really? Well, who's going to do that? Who's going to do that work?
Yeah.
Because I want to stay home as long as I possibly can.
Mhm.
And I know some technology stuff is on here, but we're going to need different types of technology to stay at home safely, be able to help us manage our aging process better than what's out there today. I don't exactly know what those tools are and that technology is, but we look at some things called living better through technology. Well, what does that mean? Are there certain sensors in your home or in your apartment, and what's available? I want that device. I want that technology upstairs just to play with when I get older. So that would be fun to have.
Back in May, we opened up what we call the doctor's office of the future in Clifton Park.
Yeah.
And it was exactly what Sue was describing. It's, people are now demanding an Amazon-like experience wherever they go, okay? We've gotten used to having packages delivered to our door, sometimes in less than 24 hours. I think that Chewy is in my neighborhood. I don't know about you guys, but I order cat food and it's there in sometimes 45 minutes. I'm like, is there a distribution center in my neighborhood or not? So we're demanding things. We want things when we want them, how we want them, and we want them now. And that's how consumers are. So when we opened the doctor's office of the future in Clifton Park, it was all of those things in mind. Electric car charging stations, valet parking, we had a cafe in there, central registration as a check-in, a children's room, a community room, all of those things, because people don't want to walk into something that feels clinical and cold, right?
Yeah.
That's what doctor's offices have historically been, and that's what we have always accepted. But the generation that's coming up is not okay with that. They want a Nordstrom rack experience when they go into the doctor's office. And, you know, you say that, you could giggle about it, but that's exactly
Well,
how people feel about it.
I'm not just saying that because, but, you know, it is a huge opportunity for people to go through what they need to get through, get out with a very low debt load or no debt load, and move on from there.
That's right.
So that we excel at that,
It's very, very consumer friendly, cost friendly.
yes.